Hey guys, it's Megan, and this is my module for discussion post. So the first question we were asked this week is, what are common signs and symptoms in children and adolescents experiencing depression? And the information I got here is from the Mayo Clinic, and it includes two groups of symptoms, emotional and behavioral. The emotional symptoms included feelings of sadness, crying for no apparent reason, irritability, frustration, anger, loss of interest or conflict with the family and friends, feelings of guilt, worthlessness, extreme sensitivity to rejection, constant need for reassurance, trouble concentrating, making decisions, and remembering things, frequent thoughts of death, dying, and suicide. And the behavioral symptoms included tiredness, loss of energy, insomnia, sleeping too much, changes in the appetite either way, weight gain or weight loss, agitation, alcohol or drug use, slowed thinking or speaking, complaints of body aches, headaches, lots of trips to the school nurse, disruptive or risky behavior, self-harm, and that can include cutting, burning, or piercing. So the second question we were asked was about the pathophysiology behind the assessment findings, and the information I found was from Dialogues in Clinical Neurosciences, and it kind of discussed monoamine hypothesis as the cornerstone of kind of the pathophysiology behind depression, and it states that the first major hypothesis of depression was formulated about 30 years ago and proposed that the main symptoms of depression are due to the functional deficiency of the brain monoanergic transmitters norepinephrine, serotonin, and dopamine. And it says that evidence from the hypothesis came from clinical observation of animal experts, which showed that the antihypertensive drug risperidone, which causes depletion of the presynaptic stores of norepi and serotonin and dopamine, induced a syndrome resembling depression. Considering the origin of noradrenergic, serotonergic, and dopaminergic neurons in the brain and their projections into many areas of the brain, it is clear that monoanergic systems are responsible for many behavioral symptoms. Abnormal function and the behavioral consequences of either depression or the manic state may arise from altered synapse storage or release of the neurotransmitters, as well as from disturbed sensitivity of their receptors or subcellular messengers. And it goes on to discuss neurotransmitter concentration, and that many attempts have been made to prove that the hypothesis of reduced monoamine availability by measurement of the neurotransmitters and or their metabolites in postmortem brain tissue and body fluids such as CSF, blood, and urine, although repeated data showing decreased levels of norepinephrine metabolite, a methoxy-4-hydroxyphenylglycol, which indicates norepi turnover in the brain, supports the hypothesis of a deficit of noradrenergic systems. It says that all the results there are inconclusive, and similarly to the noradrenergic system, the data that determines the serotonin metabolite could not prove the hypothesis of exclusively reduced serotonergic transmission. We go down here and it talks about the transporters for the neurotransmitter reuptake, and the reuptake having effects that show depression as well. It says at the end of it, in spite of all the progress that's been achieved in the last decade, we must be aware that there are still today considerable problems in understanding and treating severe depression and knowing the cause of treatment-resistant depression. So the third question was to explain the pharmacological action of drugs commonly used in the management of depression in children and adolescents. And SSRIs was the favored method of pharmacotherapy for children and adolescents. According to the Mayo Clinic, the SSRI's mechanism of action affects neurotransmitters and blocks the reuptake of the neurotransmitters serotonin in the brain. This causes the change of balance of serotonin in the brain and allows the patient's mood to be boosted. And that is my Module 4 discussion post, and hope you enjoyed it. Thanks.